Hi, my my name is Shelby Wages, and I'm going to be doing my physical assessment checkoff today. So, um, the first thing I want to do is enter the room and introduce myself. Hi, my name is Shelby. I'm going to be your RN today. And can you tell me your name and your birth date?
My name is John Johnson. I was born February 2nd, 1996.
Okay. So then I would go ahead and check his chart or wristband and make sure what he said matched what was on that. I would also then go ahead and check the doctor's order and make sure that this is the patient that the assessment was prescribed for. And if he was entering the room, I could assess his gait to see if he had any impairments or anything like that. And I would also assess his clothing just to see if he was dressed appropriately for the weather. This gives me some kind of idea on his cognitive awareness of what's going on around him. And so then I could ask, do you know what day it is today?
Monday.
Monday. Do you know what year it is?
2020.
Do you know where we're at?
Amory.
Okay. Do you know who the president is?
Donald Trump.
Okay. So he seems very aware of what's going on around him. So then I would want to perform my hand hygiene and put on a pair of clean gloves. Okay. I would also want to explain to the patient what we're going to be doing for the assessment, and I'm going to go ahead and start off by saying that we're going to assess your head. We're going to inspect the scalp, your cranial nerves, things like that. Okay, so alrighty, so to start off, I would want to look and make sure that the color matched with his body. It can be a little bit lighter up here, and I would want to palpate and make sure there's no tenderness or lumps or bumps. So, do you have any tenderness?
No.
Okay, and then I would also want to assess the length of the hair, the texture, the lubrication, all of that. So everything looks pretty good. And then I could go ahead and assess the eyebrows. They're symmetrical. And then I would go ahead and assess the eyes. So this is going to test our cranial nerves 2, 3, 4, and 6. So can you read a book that's over there on the shelf for me?
Yes. The Odyssey.
Okay, so his cranial nerve 2 seems to be pretty well intact. And then we're going to go ahead and test his 6 fields of gaze. So can you follow the pen with your eyes for me? Okay, so we're going to go up, down, and up, and down. And he seemed to do that pretty effortlessly. Okay, and so then we're going to test his pupillary response. Okay, and both pupils seem to dilate at the same time. And I would take note of the size and things like that. The eyes are symmetrical with the body. There's no redness or edema. And so then we could go ahead and move on to our ears. So I want to make sure that they're, again, symmetrical, and they seem to be pretty symmetrical. And then we would want to check the lateral symmetry with the outer canthus of the eyes. So the top of the ear is symmetrical to the outer canthus of his eyes, reaching the top. The ears are intact. The skin looks pretty good. It's the same color. There's no dryness or flakiness or anything like that. And then We could also take a look inside of our ear, and what we could do is lift up on the ear and look in. It looks normal, there's no abnormal serum or anything like that. So, okay, and then we would check this side. Okay, and again, everything looks normal. And then we could also test our sinuses. So we have our ethmoid sinuses, our frontal sinuses, our ethmoid sinuses, and our maxillary sinuses. Okay. Do you have any tenderness?
No.
Okay, and there's no swelling or obvious movement with that. And then we would go ahead and assess our nose. So the nose is midline and symmetrical in the face. I could close this side. Will you breathe in for me? Do you have any trouble with that?
Mm-mm.
And now I close the other side. Do you have any trouble with breathing?
Mm-mm.
Okay. And then I would want to look inside and check the mucosa. It's pretty pink, and there's no excessive mucus or draining or anything like that. So then I would go ahead and assess the lips. They're pink, a little dry, but they're pink. And then we would go ahead and have you open your mouth for me. Okay. Could you clench your teeth, right? Okay, and this tests our cranial nerve 5. Could you open your mouth? Okay. Inside is pretty pink and normal. There's no lesions or abrasions or anything like that. Checking under the tongue is pretty good. There's no abnormalities here. Can you stick your tongue out for me? Thank you. Alrighty, and then could you smile really big for me? His teeth are white. There's no no obvious cavities or anything. The gums are not receding. Could you stick your tongue out for me? And can you move it from side to side? This tests our cranial nerve 12. And if I had a piece of gum, I could ask him to smell it, and this would test our cranial nerve 1. And then to taste it would be testing our cranial nerve 9. So everything looks good there, and then we're gonna go ahead and, I'm sorry, I would use the tongue depressor to assess his mouth correctly. And I could also initiate a gag reflex if I needed to test that cranial nerve 9. Okay. So then we're going to assess the neck. So we want to take note of the trachea. It's pretty midline to the face and in the center there. We want to palpate. Do you have any tenderness there? No? And the skin looks good. It's the same color that it should be. No abnormalities. While we were here, we could assess the lymph nodes that are behind the ear. Okay. They're not really palpable, which is normal. And then we could also test the ones that are on the clavicle. Okay. And again, not very palpable. And then we could also test the thyroid by having you hyperextend your neck a little bit. Okay. And again, they're normal. Do you have any tenderness?
Mm-mm.
Okay. So, and then we would assess the carotid. And to do this, we'd want to go side to side, not at the same time. So can you hold your breath for me? feels pretty normal. And then we're going to go ahead and assess the chest. And normally we would have the patient remove their gown in that area while still preserving their privacy, but for demonstration purposes, we're not going to be doing that. So I would first want to inspect and make sure that everything was symmetrical, and that there's no barrel chest or anything going on like that, that his breathing was symmetrical. And then I would go ahead and count his respirations without telling you. And so a normal respiration would be anywhere from 12 or 20 in a minute. Okay? And then I would go ahead and palpate. So I'm going to go in circular motions all over the chest. Do you have any tenderness?
Mm-mm.
Okay. Alright, so then I'm going to percuss where I'm going to be listening. Okay. Alrighty, so then I would want to auscultate. Could you take an inhalation and an exhalation every time I move my stethoscope? Okay, so then I would have the patient either lean forward or stand up. So I'm going to go ahead and ask that you stand up for me. Okay, and then I would ask that he put his arms out in front of him and cross them to separate the scapula here, to make it a little more easier to listen and make sure that there's no bone in the way. While he was doing this, I could assess the spine and make sure that it was straight and there was no curvature. I would also want to assess the skin here and make sure that everything looked normal, there was no lesions or abrasions or scarring. And then I would also want to palpate. So. Everything sounds normal, so then I'm going to auscultate. again, if you would inhale and exhale every time I move my stethoscope.
Okay.
Alrighty. Okay, so if you don't mind sitting down. Okay. And then we're going to go ahead and assess the heart. Before we do this, we could also assess the arms, and again, check the skin integrity. Is the color normal? And then we could check the brachial pulse. Okay. Don't mind doing this. And we would want to assess them at the same time to check for symmetry in the blood flow. Okay. Feels pretty normal. And then we would also check our radial pulse. Or I would check them at the same time. Okay. And then I could also assess the hands, check for any clubbing that indicates any respiratory or circulatory problems, and then check our capillary refills. They come back pretty normal. Alrighty. Okay, and then we do this for this side as well. Alrighty. And so then we would go ahead and listen to our heart sounds. So what we'd want to do is for our aortic pulmonary sound, we're going to find our second intercostal space on the right. So go here, find curvature. Okay. And we want to listen with the bell of our stethoscope. And then our pulmonary sound is going to be in our second intercostal space on the left. Okay. And then our second pulmonary space is going to be on our third intercostal space on our left. And then our tricuspid is going to be on our fourth intercostal space. Okay. And then our meatus is going to be It would be easier if our patient's shirt was off, but it's not. It's going to be right below the nipple in our fifth intercostal space. And we're going to go ahead and listen to that for a full 1 minute. And when we do this, we want to make sure that we're taking note of our S1 and S2 sounds, our S1 sounds being the lub and our S2 sounds being the dub in the heartbeat. And then so if we had trouble listening to the sounds, we might have for our lungs or our heart, have our patient lean forward or lie down in a side laying position. So next we're going to assess the abdomen. So we would ask that our patient lay down for us. Okay. So we're just going to go ahead and expose the abdomen. Okay. And what we want to do is separate our abdomen into 4 quadrants, an upper and lower right side and a lower and upper left side. And so the first thing we would do is auscultate, because palpating or percussing the abdomen might disturb the bowel sounds. Okay, so we're going to listen with the diaphragm open. And again, we would also want to inspect this area and take note of any skin discoloration, scars, lesions, or anything like that. And we'd also want to check the umbilicus and make sure that there was no discharge or herniation or anything of that nature. We could also test the pulses that were down here, okay? And we want to make sure that they're symmetrical, right? Okay. And then we would ask that our patient would sit up. Okay. And we would inspect the legs and make sure that the hair was growing evenly and there was no lesions or scarring or anything of that nature. So if you don't mind laying down again, we could go ahead and check the feet and check the capillary refills on those. We would also want to inspect the toenails and make sure that they weren't thick or yellow or anything of that nature. We could also test our popliteal pulses. and our dorsalis pedis pulses. Again, checking and making sure that they're symmetrical. Okay, and then we could test our pedis pulses. Again, checking them at the same time to make sure that they're symmetrical. Alrighty. And so we would also want to check our patient's reflexes. So we would test our brachial reflexes, which I don't have a hammer, but if I did, it would be over here. And then our reflexes on our popliteal regions, percussing, or using the percussion hammer here. Okay, and then we would also want to check our musculoskeletal system. We would have our patient perform a balance test. I'm supposed to tell you that. Okay, so feet together, arms out, eyes closed. Can they keep their balance? He does pretty well. And then I would also want to make note of the symmetry of the muscles and all that, and I would ask that you put your arms out. Okay, and can you push against my hands? Again, can you push against my hands this way? Okay, and then we could also test our muscular system and our cranial nerves by asking you to shrug. Okay, and can you rotate your head side to side? There you go. This tests our cranial nerve 11. And we could also perform our range of motions on our patient. So just for a few, we would ask that you hyperextend your neck, going up like that. Okay, can you flex your neck by putting your chin down? Okay, making sure that we're supporting our joints. Can you rotate your head side to side? There you go. Can you laterally flex your head? Okay, so just things of that nature, our full range of motion. And again, we would want to document all of our findings appropriately. So for our physical exams, we might also have to perform genital exams. For a female, we would ask that they lay in a dormant recumbent position. So on a table with their feet in the stirrups. And in order to perform the exam, we would want to ensure their privacy and, make sure that we're explaining everything we're doing before we're doing it, as to not surprise them or frighten them, make it as gentle as possible. We would want to assess the growth of the hair. Is it even? Any infestations, things like that. And then we would also want to assess the labia majora by assessing the skin, making sure that there's no inflammation, edemas or lesions. And then in order to inspect the rest of the external genital area, we would want to separate the labia minora and make sure, checking our mucous membranes and making sure that the color was even and normal, and looking at the urethral area and making note of the color and making sure that there was no abnormal discharge, and looking at the clitoris, is that normal? It should be cherry red, no larger than 2 centimeters, and again, just making sure that there's no abnormal discharge or redness, edema, inflammation, things of that nature, and also the rectum, making sure that there's no hernias or lesions, And for a male, we would want to inspect the foreskin if they had it, the corona, the shaft, and making sure that there's no edema, inflammation, swelling, and we'd make sure we'd want to look underneath it as well. And then again, we would want to look at the scrotum, inspect the symmetry. It is making sure that there's no lesions or edemas, things of that nature. And we would also inspect the hair growth, again checking for infestations, and we'd also want to check the rectum for any hernias or anything of that nature. If we had to do a full rectal exam, it would be easiest for a male to be standing and flexing at the hips, leaning over on a table or something like that. And again, for the female, they could lay in a dormant recumbent position or a side laying position to do that exam. For a breast exam, we would ask that they stand with their arms relaxed at their sides, and we can inspect the outside, the shape of the breast, making sure that they were symmetrical. It is normal for one breast to be a little bit smaller than the other. We would also ask that they stand with their hands at their hips to do this too, to get a better observation of the shape and the color. We would also want to inspect the areolas and the nipples, making sure that there was no abnormal discharge or anything of that nature. And in order to palpate the breast, we would ask that the patient lay down and put a hand behind their head to check this breast for the tissue and making sure that the tissue wasn't abnormal. We could also check their lymph nodes while they're in this position. And if we were checking the other side, we would also ask that they do this. And I'm going to use my cue. I did forget one thing. I could check for a bruit with my stethoscope on the carotid. I would want to check with the bell of my stethoscope. So, go ahead. Okay. And then again, I would ask that you hold your breath. Okay. So, yeah,